So are we going live now?
Just give me a moment, huh? Mm,
So are you going live on Zoom and this both the things at one time?
so yes, we are going live on YouTube, and we are
Fine,
already
fine.
live on YouTube. So that's okay. I have managed those settings. So uh, rest assured, everything should be fine.
Okay.
Well, let's start. Dr. Kshittij, firstly, thank you so much for devoting your time today for all my audiences.
Mhm.
And without wasting much of your time, we would like to hear about yourself.
Hello, everyone. I'm Dr. Kshittij Soni. I'm a practicing orthopedic surgeon, joint replacement surgeon, working right now in Kota, Rajasthan at Chandni Hospital. So
Awesome.
thanks once again for inviting me on your channel to be live here, and it will be a pleasure talking to you.
Awesome. So, as I said, great to have you here. So, let's start with my first question. So today we all will talk about a very common problem among women, and that too it is related to back and joint pains. So, please
Okay.
tell what are the main reason behind it?
See, you know what? According to the studies, it has been found that around 70% of the Indian population, especially the women, sometime or the other in their life, they are suffering from back pain. And there can
Yes.
be a hell lot of causes behind what causes this back pain. So let's start figuring it out from one by one. The main cause and the most common cause can be an injury. It can be because of any accident, any trauma, or by even falling while working at home or something, any kind of an injury. Another second point which comes into the category of causes is any kind of sprain. Now, sprain can be even while lifting a heavy load or by sudden jerk or any kind of twisting movement. That can be the second most common reason for the back pain. Another common reason can be muscle overuse, which is most common with fatigue muscles. When we are continuously moving around without giving any kind of rest to our body, then we can cause muscle damage. It can be a reason for back pain. These are the main causes. Other important causes can be another important in women, which can be found out is pregnancy back pain. These pregnancy back pains are common in around 50 to 80% of the women, and they start mostly by the fifth month of pregnancy, and it basically occurs because of the shiftage in the weight of the body due to the gravity forces by which are acting because of the weight of the baby. uh, and how to overcome, they are very common, they can be seen in many females. And how to overcome it is by time to time changing your postures. You are supposed to take frequent breaks between your work. You should be walking. You should be getting into the stretching activities a lot. So these are the common symptoms. These can be the common causes of back pain. Another common cause is your fitness level. So it can be a major problem. Fitness is the main thing. You need to strengthen your core muscles. Core spine muscles need to be strengthened to maintain your posture whole throughout the day. And suppose if your back and core muscles are not strengthened, then you are prone to get injuries which can be muscle spasm. So it's basically you should focus on getting yourself fit from time to time.
Okay.
Yeah.
So since we are talking about fitness and these are very common problems, can you share some reasons, some solutions to cure this pain easily, with our day-to-day, easygoing activities?
Uh-huh. So basically, you need to understand that there are two kind of back pain. One is acute pain and the other is chronic pain. So if we talk about acute pain, जैसे ही एक्यूट पेन कब होता है हमको, तो ये तब होता है, सपोज करो आपने बेड से उठते टाइम आपको एकदम से जर्क फील हुआ बैक में, और यू गॉट अप इन द मॉर्निंग एंड यू एक्सपीरियंस सम काइंड ऑफ पेन इन योर नेक. So this is an acute kind of situation where you got a sudden pain. Now in that position, I would advise everybody out there. There is a common myth that these people first tend to go to the physiotherapist to get the physiotherapy done. Let me make it very clear to you. This acute pain is not the stage for you to start the physiotherapy. This is the pain where you want rest. Your back needs rest. And as I told you in the causes of the back pain, because of muscle fatigue, because of not strengthening of your muscles, you can get these kind of pains which are acute in nature. So in these cases, you're not allowed to do any physiotherapy. The first thing you need to do is give rest to your body. This rest will decrease the spasm which has caused the pain. So relax yourself. And the other common thing you need to do is you need to do an hot, moist heating pad apply on it. Do not apply ice on it. There is a lot of confusion regarding this thing, that when we should apply ice and when we
Yes,
should apply the hot thing,
correct.
you know. So in acute pain where you have this spasm, muscle spasm, always apply a heating moist pad. Do not apply a hot water, but you should have a hot moist pad for it. This is the thing. Now when we talk about the chronic pains which you are experiencing for continuously for 2 months, 3 months, in such kind of pain, you should first of all you should make it a point that you consult your doctor. You should not ignore it. If something is being prolonged, then there is some issue for sure. And to find out the issue, you should visit your doctor first of all, rather than visiting a physiotherapist automatically. But yes, if your doctor examines you and he wants you to go to a physiotherapy for a rehab, then you should go ahead with it. And chronic pains are most of the time relieved with the help of a physiotherapy. So taking care about it is not a big deal.
Okay, then that's interesting. In fact, it's an eye opener, we all we don't even realize whether it is an acute pain or the other pain. And we blindly go to the physiotherapist. People suggest here and there, but then good. Thank you for advising this. Yes, we all should go to the doctor, consult, and then we should start with the relevant remedies.
Relevant
So,
treatment.
Dr. Kshitij, my another question is: are there any home remedies or exercises for
Hmm.
women which they can do at home to cure these issues? Maybe a normal, like you rightly said, that maybe after pregnancy, also a lot of women's we face these back issues, or otherwise also, since we women's are loaded with so much of work together, so non-stop working together,
Multitasking.
and then yes, so we don't get time many times to take proper rest. So are there some simple basic exercises which we can do at home and stay and keep ourselves fit here?
Keeping your back fit is as important as working for yourself. What you females are doing all day. You are always on your toes, and it's time for you to think about your back as well. So first come first is you should avoid maintaining a prolonged static posture. You should be moving around. You should be stretching around. You should be changing your desk. If you are into IT industries where you have to sit whole day, I would recommend those people to have a desk which where they can stand and work rather than sitting and working. Standing and working should be the main. It helps to erect your spine. It helps to your body to move around. So, first thing you should have and another thing you should have if you're sitting and working, then your table and desk height should match. It should not be like that आपकी screen जो है वो इतनी height पे है या फिर इतनी low है that you are looking down and working. This will create an issue with your neck, and you will have spasm in your neck muscle. Yeah. So another thing is that next you should there are many home remedies which you can apply in your daily life. Like anti-inflammatory drinks are there which you people can have it at your home. Number one, according to it, is turmeric milk, haldi ka doodh. Haldi ka doodh, it works as an antioxidant, anti-arthritic, and it has an anti-inflammatory agent into it. So, and the best time to consume it is by the bedtime. Another thing is green ginger tea. Green ginger tea, it reduces the overall inflammation, and it prevents the new inflammatory pain, which can be, which can come by any spasm or the kind of thing I was talking to you about, while the pain you're getting when you're getting up from the bed, or twisting and turning pain. Another thing is vitamin C supplements and vitamin B6. Vitamin C and vitamin B6 are considered to be uh, natural steroids for your body. They not only control your metabolism, but it promotes good sleep. And good sleep is as important as for you is as it is important for your muscles. Your muscle needs time to relax. They need time to breathe, and good sleep will provide them that. Now, coming on to the hormonal things, let's talk about melatonin. Melatonin is a hormone that improves your sleep cycle. Now, how to increase melatonin naturally? It comes by reducing your screen time. You should cut down on coffee. You should get yourself exposed to sunlight. You should eat right food. Reduce stress. I know this is highly impractical in today's life, where you are moving around whole day and night. But yes, you should focus on reducing your stress, increase your relaxation. And the best source for melatonin is warm milk. You should have warm milk. And
Okay.
another hormone which is important is L-theanine. L-theanine is an amino acid. It helps you to get proper and better sleep. And now, where you can find it? You can find it in green and black teas, and even in mushrooms. So these are the anti-inflammatory things. You can try it at your home, and yeah, you can get rid of getting the back pain into your body.
Okay, this is completely a new thing and a big news for me that we all know, like turmeric latte to my audiences, to make it very simple, it is like a haldi milk. And abhi tak we were
Exactly.
been having this haldi milk only during cough and cold. But then, yes, it works as an anti-inflammatory, which is like a news to me and to all my audiences. Let's go back to our roots and start having these things. It's very readily available at our home, and that too, thanks for sharing that it has to be, we should have these things late in the, after dinner, if I'm not
Just
wrong,
before the
right? These
bedtime.
things.
Just before the
Yeah,
bedtime.
yeah, that's really interesting. So even children
Mhm.
can have this,
Yes,
as
please. Yes, please.
okay, that's really interesting, and these are very much available at home. Taking a normal sunlight, having a turmeric latte, that is healthy milk, and so on. So yeah, okay, thanks for sharing. So, my another question to you, Dr.
Mhm.
Kshittij, is these days we all talk about bone density. So, I have a lot of
Right.
questions in and around bone density, but before we actually go ahead, I want to understand from you what exactly it is. Let my audiences know what exactly it is.
Okay. Back pain and bone density. If we talk about it, they are somewhere related to each other. First of all, and bone density is known as bone mineral density. Bone mineral density, it checks your bone health. So, it is the best measure to find out what is your bone health. So, how it is measured? It compares your bone density to a healthy person's bone density, who is of the same age and same gender. Now, according to what all results you get from that bone density, you are then divided into different categories, whether you are healthy, whether your bone is healthy, or whether you are osteoporosis you have, or you have osteopenia. You know, this is about bone density.
Okay, interesting. So, what is the ideal and normal range of any bone density? I mean, I understand it will be related to height, weight, and all, but then what is the ideal range what we generally talk about?
Ideal range for bone density can be figured out by a scan known as DEXA scan. It
Okay.
is available. It is available by which you can check your bone density, and it has a different kind of gradings. So the thing is, if your score is more than one, then you have an healthy bone. If your score is uh, coming from -1 to -2.5, then it is considered that you are having a borderline problem, which is known as osteopenia. But if your score is less than -2.5, then you are considered to be having an osteoporosis, which is decreasing in the bone health, in your bone health. And this osteoporosis is mostly seen in females, and when they are mostly seen, they can be seen with low estrogen hormone level. Now, when is the estrogen hormone level low? It will be around menopause, when your body it will undergo many hormonal changes. After menopause, your body starts producing estrogen. So estrogen level will be low. When estrogen levels are low, it is a major risk factor of developing osteoporosis. This is one reason. Another reason in female is the breast cancer. Treatment of breast cancer will lower down the estrogen level in your body, and invariably it will again lead to osteoporosis. The third point, which is a major important, is hypothyroidism. Females who are suffering from hypothyroidism will have the problem of bone loss, and in bone loss cases, again, you will be suffering from osteoporosis.
Okay, all right. So, what generally happens if the bone density is low, and what are the ways to improve it? So, people often, we don't even get it checked many a times. Today we got to know from the conversation that there are certain things through which we can get it checked. But what happens if it has been neglected? What could be the repercussion of it?
Mhm. So, if you are suffering, having a back pain or neck pain, you should not ignore it. First of all, I would recommend everybody to go and get it checked, because most of the times what happens is, if you are having osteoporosis or osteopenia, then even a small minor trauma, if you are, suppose you're walking and you hit yourself with any door or any wall or something at your knee or somewhere, then it might end up leading you to a fracture. बट कई हमारी मेंटेलिटी क्या होती है कि यार मेरे को तो ना, तो मैं गिरा हूं ना एक्सीडेंट हुआ है, तो मुझे फ्रैक्चर नहीं हो सकता. बट उस केसेस में क्या होता है, अगर आपको ऑस्टियोपोरोसिस है तो आपकी बोन्स वैसे ही वीक है, और उस वीक में अगर आपको माइनर ट्रॉमा से भी फ्रैक्चर हो सकता है, यू शुड नॉट इग्नोर इट फर्स्ट ऑफ ऑल. एंड मेनी कॉमन फ्रैक्चर्स which can be a sign of osteoporosis is, in females, if you see, wrist fractures are very common, which can lead to which can guide you towards osteoporosis, that yes, it can be osteoporosis. Another common problem is back pain which can be associated with any compression fractures of your spine. And another common fractures which can be seen in osteoporotic people are hip fractures. These things should not be ignored if you are facing. And there are something called as stress fractures. That if there is a particular stress over any part of your bone, and this stress is increasing, suppose you are having a hip pain, but you are walking around every day and you are just ignoring it. So this point of stress can even lead to stress fractures in people who have osteoporosis. So if you have some kind of pain which is going on for a long time, I think you should not ignore it.
All right, this is interesting. And so, what are the ways to improve it? Wanted to understand.
You should be having a good diet. You should be focusing on taking on calcium. Calcium is available in your green leafy vegetable. It is available so freely in all your diet items. Fortified juices like milk, like grains, and if you are into eating fish and all, it is available in fish. And another main thing is vitamin D supplements. Vitamin D, either you consume vitamin D by the direct sunlight, which is invariably not possible these days, and especially to those people who are living in metros, because they are already living in flats, and also getting sunlight is not possible. They can go for vitamin D supplements. Now, vitamin D supplement you should be taking. It has a protocol. First 3 months, first 1.5 months for 6 weeks, you should be taking 60,000 international unit capsules for once a week. Followed by, this should be gradually tapered, and the tapering should be fortnight. It should be taken one tablet, means after 6 weeks you should be focusing on taking one tablet in 15 days, and then you should be going on a doses which are like one dose, one tablet for 1 month. Vitamin D and calcium supplements, you should be focused on taking these things. And absorption of calcium by your body is invariably dependent on the vitamin D level. So you should be having a good vitamin D level to have a high amount of calcium for your body.
Okay, this is interesting. So, yes, all women out there, along with our healthy diet, we should also now, there are certain supplements which, unfortunately, we living in urban areas are, we are less exposed to the sunlight. So, yeah, I mean, we should be having these supplements, as per, the requirements. So also wanted to understand, Dr. Kshittij, is there any age criteria? So for example, if somebody is living a very normal life, no pains, nothing, but people often talk about that after a certain age, you all should start, iron tablets, calcium tablets, and as you rightly said, vitamin D tablets. So, is there any age cutoff or, after 35, women should be having these things. So is there any criteria to take care of it?
As I mentioned earlier in my talk, that in females, it is about the hormonal changes which takes place in your body, and these hormonal changes comes into picture around the menopause. You know, at the menopause time of menopause, the hormonal changes are so much so that the estrogen level starts going down, and estrogen is somewhere related to your calcium intake and calcium regulation. So if there will be less calcium regulation in your body, the thing is, your bones on a daily basis, they are growing and they are degenerating. So it is a continuous process. Now, what
Mm,
happens after hormonal changes is the degradation process continues to go along, but the production stops. You know, so the
mm,
bone is not growing now, but decaying process is continuous. So how do we manage it? We should manage it by taking the supplements, so that so when around 40, 45, 45, 50 years, 45, 46 years of age, we advise females to get a DEXA scan done if possible. And if they can't afford it, then calcium and vitamin D supplements should be started in their diet. And they should get a regular checkup of their calcium and vitamin D levels, B12 levels as well, which is important, which accounts for burning sensation in the feet, or vague pains in your body can be related to calcium, can be related to vitamin D levels, can be even related to the uric acid level in your body. So you should go and get it checked at least 3 to 4 once in 3 to 4 months.
Okay, all right. So again, it's a good tip by Dr. Kshittij that we often we see that it's a minimum pain. We just apply any ointment, and we are a little careless about going for a regular consultation to the doctor. So yes, I think once in 4 months is very very important for all women out there that do visit doctors and understand your ratio about your calcium and other things, so that we all live a very healthy life, because end of the day, if we are healthy, we can keep our family healthy and happy. So that's
Exactly.
very very important. So the last but not the least, Dr. Kshittij,
Mhm.
I want you to share some tips to all our women audiences, even young moms, that how to stay healthy, fit, though most of the things you have covered, but then some mantras which you would like to share with all of us.
The mantra should be so simple that everyone can take it as a home message. So the main thing is you should focus on staying fit. Now, what are the components of staying fit? The first thing is you should be in the position to exercise regularly. You should be focusing, number two, you should be focusing on warm up and cool down before your exercises. Warm up and cool down are the heart of your exercises. If you are not warming up and cooling down before and after the exercises, you will be end up eventually hurting yourself. Number three, you should do stretching regularly. Number four, I think, I know there is a problem, but I would say that try to reduce your screen time. It is highly impractical nowadays, but you should try to focus on it. Another thing, you should have a healthy meal. Number next is, don't ignore your pains. There can be a reason behind it. Don't try to just go around with it कि ठीक है चलता है, नहीं चलता नहीं है. Don't ignore yourself. If you can focus, if you can give full time to your work, you are punctual about your work, your offices, your health, but I want you to be focused about your health as well. Don't stress yourself. It is highly impractical thing, but you should try not to stress yourself. By following these small things, you can eventually get out of many, not just back pain, but many problems and many health diseases.
Okay. All right, yes, you have summed it up really well, Dr. Kshittij. Thank you. So, healthy diet, exercises, less stress, and less screen time, those things we need to balance it out. So thank you so much, Dr. Kshittij. It was really a good learning for all of us. I'm sure audience will agree to it that
Mhm.
yes, in day-to-day life, we few things we already know but we often forget and we need reinforcement. So thanks for reinforcing a lot of things.
Thank you
And
so much.
yeah, and thank you for sharing some tips and tricks and the mantras behind a very healthy life. So
It's
thank you
my
for your
pleasure.
time.
It's my pleasure. It's my pleasure.
Yeah. All
Thank
right.